Hello, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I am Sarah Duval, one of the co-hosts of this podcast. Every listener of the podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Dr. Anish Kapur, founder and president of Focal Point Holdings, and Greg Grasso, director of business development, Focal Point Holdings, about utilizing strategies from non-medical industries to improve your patient experience and increase revenue. So let's jump in. But before we get started, guys, why don't you take a minute to tell us about yourselves? Who are you? How did you get into ophthalmology? Tell us your story.
Sure. Thanks. Thanks for having us. This is Dr. Anish Kapur. You guys could call me Anish. Just a real quick background on my end. I am actually an internal medicine physician, so please don't hold that against me. I have a long background in medicine and also tech. So I'll go back a generation real quick. When you have a device, let's say a cell phone or a computer or what have you, and you connect to a Wi-Fi network, your device gets something called an IP address. And that IP address is how we identify, what devices are where when it comes to a network's mapping. So my father was on the team that helped develop that. So I've been around tech since I was born. I literally remember getting the first CD burner and me and my nerdy little brother running up to it and thinking it was the coolest thing in the world, right? So went to med school, went through residency, and my attendings found out I typed really fast. So we had an EMR system in the hospital, and they found out I typed real fast, and they were typing with just one finger, and I became the guy who had to type up everybody's notes. And so for years and years, yeah, no joke, it was rough. Late nights, just typing and typing. And I started developing shortcuts for myself and realizing that, hey, they're doing the same thing over and over again. When I got out of residency and I was considering my next move, either, in practice or a possible fellowship, I was talking to my father, and he said, hey, listen, I'm working with these ophthalmologists, and nobody is building a specific EMR for them. So, I met with them, went through it, and we developed iMedicware, which was an ophthalmology-specific EMR and practice management system. And, literally grew it from two guys in a basement to 70, 80 employees, and, really, captured a lot of the ophthalmic market. We tried to design it in a way where, an ophthalmologist was in and out of the room in 6 to 10 clicks. We grew it, and in 2017, we were acquired by Eye Care Leaders. We worked there for about a year or so. And then after that, we left to form Focal Point Holdings. And within there, a company called Promptly, which is our technology arm that works on automation and the patient experience. During that time, while I was at iMedicware, I met the other member on this call, Mr. Greg Grasso, and he is our director of business development. And I'll let him introduce himself from there.
Yeah, definitely not a doctor. I definitely, maybe over time, working with some of the best in the tech side when it comes to ophthalmology, I could have a doctor on the software sides.
You just play one on TV, huh, Greg?
Yeah, he stays at a Holiday Inn Express every once in a while, so it works out.
Yeah, they said I have a face for podcasts and radio, so I'll just keep that. But yeah, I actually met Dr. Kapur and the entire iMedicware team coming from a background in promotions and marketing and really customer and listener, I guess at that point, experience from working in radio and TV. So knowing from a marketing perspective, where we're trying to reach out to and like how to kind of brand and, make sure that our software is like one of the number one, not only user-wise in the market, but also just an experience-wise for both the staff that's using it, the physicians that are using it, and obviously like the patient experience side too, when it comes to communication and different areas of just like the interactions and what I like to call it the transfer of information, when it's like demographics, insurance, and obviously like treatment plans, and how you're going to make these patients feel comfortable, but also, enjoy their experience when they're coming into the office. And like Dr. Kapur said, with the software itself, nobody likes to stare in front of a screen for too long, because you want to have that human connection, that interaction with the patient. So being able to have like a 6 to 10 clicks and out, and then have that, communication with the patients is obviously super helpful. And, I'm coming up on almost a decade now working with Dr. Kapur and being in the ophthalmology market specifically. So it's been, quite the ride and quite the change, but I think it's also brought a new sense from my perspective and background, being able to help when it comes to the customer, the patient experience, when it comes to communicating and making sure that they're being communicated with the way that they want to, how they like to receive information, and the best way to feed that back in for the practice so they can utilize that data, not only to improve, workflow and efficiency in the office, but obviously there's revenue increases that come along with that information as well.
All right. Well, this is exciting. I'm really, really glad to have you guys on. So let's jump in. How much correlation does the patient experience have with the business side of an ophthalmology practice?
I think a whole lot. I mean, like there's, obvious ties like Google, Facebook reviews and stuff like that. But like, if we look at like the target markets, and especially as they're evolving, as you have the baby boomer generation that, is right now one of the biggest markets within ophthalmology, right? Those are the people who are cataract age right now. And that's what I think a lot of focus on. But like millennials have the largest buying power according to Forbes. So, and they kind of stratify as the groups that are interested in LASIK, contact lenses, glasses, premium services, cosmetic services. And then they also are, going to be getting older and getting to that point where they're in that cataract bracket as well. And the buying habits that they have are completely different than the previous generation. And I think that we're also seeing that, as Gen Z is kind of like getting their foothold in being able to buy things as well, that they have a completely different view as well. So it comes down to simple things. There's a lot of like, I think things that as I guess I'm going to say an aging millennial would just expect, that I see in a lot of other industries, that if the ophthalmology industry gets behind them more, would really increase their buying, the amount of services that are purchased through by that target demographic.
Yeah, and obviously too, when you're looking specifically at ophthalmology, like it's such a highly contested market, especially when you're looking at like certain states and certain regions where, if they just do a quick Google search of, eye doctors in my area, not only are you competing with reviews and how the algorithms are kind of set up, and obviously also like SEO, and, with so much PE going around, and larger practices having the budget to be able to go in and have those, clickable ads at the top of the screen. And, if you ever go on Google, like when's the last time you went to the second O? Like if you're not in that top 1 to 3, and even past the point of like the ads on the top 1 to 5, let's say, in that first page search, it's going to be hard for you to contend and like capture that new market, or those new patients that, every year, one of your top 3 goals for a practice is new patients. But there's other ways, obviously, to kind of help outside of spending a ton of money and competing with like the big dogs in the market to capture that patient base, that you can kind of, help the practice and obviously increase revenue with, when it comes to, patient satisfaction, patient experience, and just like the different ways and technologies that are out there now to communicate with patients, both that haven't been seen or at the practice yet, but also the ones that are kind of buried in your practice management system, and like the ones that kind of fell through the cracks and are in what I like to call like practice management purgatory. And it's been seen a lot lately, just because of the last, obviously, like 2 years with the pandemic, where you're running through staff at the call center or the front desk, and when you train somebody new, you're using your best person to train them, and if they get burnt out and leave, then the training kind of misses out on the next generation, and so on and so forth. So by the time you get 3 or 4 branches down on training, you've probably lost some of the key aspects of what made the practice so strong. So it's looking at different ways to kind of automate things to And so you don't have to compete with all the big market and big SEO groups that are out there, and finding different ways to use some really cool technology that's available to be able to go in and find new patients, or find patients that, we had a new staff member do a call. They spoke to him once, didn't book a follow-up, didn't mark it in the system, didn't really do anything else with that information. And they left a week later. And now that's one patient that's just buried in the PM, that unless somebody is searching for it themselves manually, when are you going to interact with them again, and try to bring them back in for their care, and, to meet their physicians, and obviously collect the revenue side as well.
You just said something that was, oh gosh, probably the biggest pain point, right, for so many of us right now, is the understaffing and the burnout. I was just thinking about my own practice when you just mentioned that. If your lead trainer is getting burnt out, then that's starting to suffer all the way down. And oh gosh, it just couldn't be more true, right? I mean, I don't know if you guys are noticing it in your industry, but of course you work with so many practices that you're probably hearing it all the time.
Yeah, it's funny. So I was talking to a practice. I'm not going to say their area, but they said that and this is a true phone call that I had, where they said that a Panda Express has opened up nearby, and they need to get an automation software in place for their front desk as soon as possible, because a lot of their people have left for Panda Express. And I was like, wait, what? They're like, yeah, because look, we're the area of the country where we are not getting more money. We're not making, it's not like Medicare reimbursements are going up all across the board. Right. So, they said, we cap our front desk employees right now, they make somewhere around $18 an hour. Well, when Panda Express moved in, they're paying $18.50. Well, some of the employees said, oh, for 50 cents an hour, and I don't have to deal with patients, and I don't have to deal with, the complicated systems, and learn the PM system, and, make sure that all the consent forms are signed off correctly, and I don't have to deal with the administrator, and I don't have to deal with any of this.
And learning insurances.
Oh yeah, all that, and I make 50 cents an hour more. Even if they match that 50 cents an hour, some of those people are going to go. So, it's tough, and not only, are we seeing staff shortages across the board in every industry. I mean, I think, we're just seeing that in general, which again, we can have a whole separate podcast about where were all these people. I don't know where they all went, but
if you find them, Dr. Kapur, if you find them, tell me.
Yeah, honestly, I think that'll be a gold mine in itself, right? But I mean, I think that there's also just some simple things, when you start talking to practices and you say, you talk about Google and you talk about how you find places, so one thing that recently I did, and I was giving a presentation at one of the trade shows, and I said, listen, for somebody like myself, the first thing that I am going to do is pull up my insurance, right? So I go to Blue Cross Blue Shield's website or my Blue Cross Blue Shield app, and which ophthalmologists are in my plan in my area, right? And so I did that live, and I went through and I clicked on every person, starting from the top, and it took me 3 pages to click on somebody on the Blue Cross Blue Shield website that had a website that was linked there. And then when I clicked on that physician's website, and I go there was no place for me to schedule online. So especially somebody who is, a professional, and they're working, my reminder system of when I need to get something done is my wife telling me, hey, you made that appointment, right? And the time that she tells me to do that, and again, I love her, but she tells me at 8, 9 o'clock at night, no practices are open. I need to, so having the ability to find it, even through my insurance, be able to go to their website, and then also to be able to request an appointment, and not hey, fill in this form and it goes to us and we'll call you back, because you're going to call me back at a time I can't pick up the phone, right? Just show me your availability. It should be that simple. And I think that's why a lot of systems like the ZocDocs of the world and softwares like that we work on and things like that, that's why they're becoming so prevalent, because people want that convenience. And if you give that to your patients, I'll drive an extra 20 minutes. I don't care if I know, hey, next time I need an appointment and I remember at the 11th hour, I can book it. Okay, that's fine. It does like, and that kind of breaks down that whole like, well, I'm the only game in town mentality that I think a lot of these practices have.
Mm. So with your technology background, I mean, do you feel that ophthalmology practices are keeping up with the times, or are you saying no, basically, with
Well,
like,
so I think they do, and we see it a lot on the clinical side, right? If you go and you walk around the trade show floor, people are shopping for the latest lasers and surgical tools and all that kind of stuff, right? But when it comes to, I think the front office piece, it gets a little bit ignored, right? Like,
I
because
would
if it's
agree.
not broke, let's not fix it.
I would agree with
And I
that.
feel like, yeah, and when you go around, like I hear a lot of the same excuses as well of like, our patients are older, our patients aren't going to know how to do this kind of thing. If you go to the airport, you are hard pressed to find someone who can help you. Everything is automated. And the people who are traveling, they have adapted to it.
Mhm.
And it works. And it doesn't matter how old they are because yes, okay, there's a certain part of the population that is not going to get on board with it, but it's becoming smaller and smaller. And everybody else is, especially after COVID, right? Especially after the pandemic, we've all gotten a crash course in how to use our devices and devices that are available to us to move forward and to make sure that we're all kept in the loop and moving forward with what needs to get done.
Yeah, even if you look, at different industries and even just different pieces that are now tied into your phone or into your computer or your tablet, like banking is trying to make everything streamlined online. Like even if I want to pay somebody, there was Venmo and PayPal and all these different pieces, and now all the banks are hopping on to Zelle and some of the other features that are out there where I can just quickly connect and pay, or oh, you paid for dinner, here, let me just Zelle you some money really quickly. So yeah, everyone's kind of adapting to that same mindset, even to the point of, the biggest places in the country with the stigma of having the worst customer experience. I just signed up a few weeks ago to get a real ID from the DMV, and everybody knows just from TV shows and movies and just like an overall assumption across the country, like not many people can agree on one thing, but I'm pretty sure everybody at the same time is like, oh, DMV is the worst. But
Right,
I
right. We're
went on
all
their
rolling. I was rolling
yeah,
my eyes as soon as you said that.
but I went on their website and I was like, well, I think they moved it back all for the travel for airlines because they said like you need to have a real ID by this date. And now apparently it's like 3 years from now. So like thanks, but I'll keep my appointment anyway. I
Yeah.
signed up for a real ID at the DMV on their website in 2 minutes. Like it was very simple. And that's the DMV, the place where everyone is just dreading, like, oh, I gotta like renew my ID, or I have to go to the DMV for this. Like, I better carve out 17 hours of my life. Like, no, like even the DMV has figured it out to just, here's an open slot. You have 30 minutes that we're going to allot you for your real ID. And if the DMV can do it, I'm pretty sure anyone can do it. And especially with our background and who we're working with, like we have like retina specific practices that are using different system in places and trying to get intake forms and check in and everything else. And it's like, well, if a 85-year-old with like diabetic retinopathy or macular degeneration or what have you can like use these systems in place, I'm pretty sure anyone can do it. So
It's funny. Go ahead.
that's kind of the end point of just, yeah, again, just creating it into a system of preference based, though, because it's one thing to say the technology is there and now you can use it. It's another thing to say it's there but it's catered to your experience and also to your comfort level. Because myself, like all of us on the call right now, doing the podcast, like obviously like we kind of grew up with it, but it might be easier for some people to have their preference of, well, I don't like text or email, like call me, or those things are too small if I'm using my phone. Like, is there different ways to do things? And like, you don't want to pigeonhole people into like, if you want to do this, this is the only way. You have options, just like other industries, there's options for all of it. And to kind of go to the first part of the question, it was the clinical side and treatment and care and newest technology and best outcomes for patients. Like, it's excellent. And that's where we're very far ahead in the ophthalmology industry specifically. But especially when you look at other medical specialties, like even like dental and some of these others who have a great system of bringing patients back in for their cleanings every 6 months, and everybody kind of knows that's when I need to come in. They don't have the same technology and software available that the ophthalmology space has. So when stuff's out there that you can use, like, it's very cool to be able to go out and see all the options that are there, because every practice is different. You know, they're all unique. Some are going to like certain aspects over another, but when you look at lasers and newest lenses and everything else, like at the same time, take advantage of what's out there in the space that like other specialties or medical practices and industries just like don't have access to.
I also want to just kind of point out that like I don't blame the ophthalmic industry, because like it's driven by the physicians, right? And the clinical side is what drives the practice. And I think that's why there's always been such a focus there. But I also think that people sometimes forget about like kind of a universal rule of first impressions, right? Where like if you ignore the front of house and don't upgrade things there, as somebody who's not in the medical industry, if someone who has no background about medicine, you can tell them, hey, we have the latest XYZ technology in our practice, this and that. But like if they see somebody who has a lot of these automated systems, and they see somebody where they can book online, they see like all of these things, like it gives them an impression automatically that this place is a tech forward establishment, right? Like they get that right off the bat. If they see a website that looks dated, and they see a with a no ability to pay online, and you have to download these forms and print them out and fax them to us, and things like that. Like when they see that kind of stuff, no matter what you have in the back of the clinic, they already have the impression that you're behind the times. So like I think that like you kind of stub your toe in that respect and say like, well, we have all this great stuff in the back, but people who aren't in our industry or not in medicine, they don't know what that is. And getting them in the practice and making that easy for them, that's probably more important than them knowing that you have the latest model of whatever you have. And I also
I was gonna say, I picture somebody with like a $200,000 machine in the back office, and the front desk is like etching out on like a stone tablet, like the schedule of that patient's appointment. It's like, whoa, like there's like two different ends of the spectrum here,
It really is. I mean, like, and I think also because, especially in ophthalmology, and we see this a lot as well, we're like, and I'd love to get your opinion on this. Do you think maybe part of that is also because things have been so fragmented? Like you use one thing for your reminders, another thing for your reactivations, another thing for SEO, another thing, and then you end up having 70 logins, and you're like, listen, the last thing I want to do is add more stuff.
Right. I would absolutely agree with that. But you know what? This last part of the conversation, that the things you just brought up, I don't know that I've ever even really thought about it that way, about the impression that we're giving in our front and how it may not match the messaging for what is in the back of the office. Like we want you to upgrade to this ATIOL or, or femtosecond cataract or whatever, but the front desk or the front of the house, as you say, doesn't really match that messaging. I don't know that I've ever quite thought of it that way. So
yeah, for sure.
That's that was a great example. Thank you for that.
Yeah, no, and I see that all the time. Yeah, honestly, that's my big piece. Like if you go to a practice, even just something as simple as like, they hand you an iPad, or they tell you like, hey, just scan your license and it's going to import everything for you. You're like, well, that's cool. All right. And there's nothing worse than having to fill out a paper form, give it back to them, and then have it reviewed again, and then have somebody talk to you and add it to the EMR. Those kind of experiences and that kind of time sink, I think is something that, especially as the millennial generation gets older, they're not going to put up with it. They're just going to say, you know what, down the road, I can not only schedule at any time at 11 o'clock at night while I'm watching TV, but at the same time, if I'm in and out, because they have all these automated pieces, I'll go back to that place. Why wouldn't you, right? Because I don't have to I can go on my lunch break instead of having to go every, and take off half the day.
It's funny, like we're hitting like a flip of the switch and like a crossroads of like generations where well, I don't want to be staring in front of a computer because I want to have that face-to-face interaction with my patients and talk to them. And now the patients are flipping and be like, well, I don't want to have that face-to-face interaction. I just want to be able to click some buttons and then just like get in to see my appointment. So like the
Right.
physician side is like, well, like I want to have that human connection. And now as technology grows and everybody's kind of getting used to, for good or for worse, just the ability to like get things done in a timely manner in my preferred method, it's really creating like a shift in the overall thought process that just needs to be considered. I'm not saying that like you need to like do things now and things like that, but as times change and new technologies come out, and obviously the way that patients want to interact with you changes, it's good to have different tools in your bag to customize that person's experience, because some are still going to want to like, the doctor only spent 5 minutes with me, and you're going to hear about that on Google and it's never coming down, and you got to try to bury it with good reviews. But at the same time, there's going to be patients that are like, that was great, I was in and out of there in a half hour, I got the information I needed and I went on my way. So it's really catering to the patient experience, and it's not one right way of doing things. It's really understanding that each patient's unique, and just like their treatments and outcomes, like you want to cater it to that specific patient or that specific patient population when you're looking at certain demographics or comfort level with technology and so on and so forth.
That's really, really good point, Greg. It's so true. Definitely something to be considered. And I think a lot of practices probably have already started considering it, but there's probably a lot who haven't really. So there's a good takeaway from anyone, for anyone listening to this episode. If they take away nothing else, then maybe they'll take away that part. So guys, what are some specific areas that you think it should be a focus when it comes to improving the overall patient experience for a practice?
Yeah, I hate to kind of like echo back, but the first thing is I would just say is being able to schedule as easy as possible, right? It makes things very convenient for your patients, and they come to expect it because so this is another study that they actually did, that they did say that in the millennial buying group that they are willing to drive anywhere from 35 to 45 minutes extra if they view that it will be a more convenient visit for them. It was done across a lot of different industries, so not just ophthalmology, of course, but I think that needs to be something that's stressed to ensure that you capture that entire market, right? Make things easy. Ensure that they can go from their insurance to your website at any time, and that they have a way that they could schedule an appointment or see your availability as a new patient, or to book a follow-up or certain kinds of visits and stuff like that. And then I think the next important piece is going to be when it comes to the front desk, because not only is there massive staff shortages and turnover there, but the retraining takes time, and there's a lot of different places, even when it comes to from fast food to the airlines to everything else, where people are used to handling things for themselves, and it puts it on their time, makes them be able to be more self-sufficient, put in more information and get it to you. There's less humans needed on your side, so that if you do get in a situation where you're short-staffed, you're already prepared for it. I think that unfortunately, a lot of practices start reacting instead of being proactive. So when things are good and they have a full staff, okay, no need for this. But then the minute they don't, they rush to try and implement something. And I think being proactive, especially in our industry, is one thing that ophthalmology is really good at. And we should really use technology to plan for things like turnover and filling schedules and things like that. So.
Yeah, and there was a really interesting Gallup report that went out, especially when we start talking about, well, really what everybody's talking about right now is like with hiring and obviously like keeping staff, retention, and then looking into like, well, I have all these different job application websites up to like try to bring new people in, and even if I'm getting results, which isn't always the case, they're like not showing up for their visit, or they're not showing up for their interview, or they do show up for their interview, often the job they accept it, and then they don't show up for day one, or they're gone 2 weeks later. And it was a really interesting study to show what's going on across industries, and how like sometimes it's it's actually more cost effective to keep an employee that's, working at like 70% capacity than trying to hire somebody new and spending all the money that goes along with that on, putting the job applications out there on the different websites and taking your team's time to, go through the interview process and then train them properly. And then who knows, 3 to 6 months later, they're working at Panda Express. And now you got to start the entire, a nice circle back to that, right? So
Right,
whoever
yeah.
listened to me. So
job.
now you got to start that whole process over again. And it's like, now the person that just walked through this now has to do it again, and they're getting burnt out. And like they're probably your, top or one of your top employees, like the one that buys in and makes sure that everybody's on the same page and like creates that good work environment that people want to stay at. But now they're getting burnt out because like, we got to hire somebody new again. I have to retrain them. And it's just a slippery slope. So it was an interesting article to see, like, it's actually like saves money to keep a less productive employee than to go through the process of rehiring, retraining, just in case that person ends up leaving and you start it all over again. It's a tough time for, I feel bad. Like I wouldn't want to be in your shoes, Sarah, unfortunately, just because I know, as you already said, like you're kind of dealing with this every day. And like many practices and probably people that are listening to this, like they're like nodding their head, like not in agreement, but at the same time, like shaking their fists at the air. Like, why does it have to be this way?
Absolutely. I mean, even just this week, I had somebody who seemed really promising on paper and very pleasant on the phone. And she was supposed to come in, I think it was Wednesday afternoon for an interview. Everything was confirmed. And then she emailed me about 2 hours before that and basically said, thanks, but no thanks. I'm going to go a different route. Like, really?
Yeah.
But I mean, and that's not even one of the more extreme examples.
I'm surprised they even answered you.
So frustrating. Yeah. It's so challenging to say the least. And it's just really, really hard on the team.
Things get lost.
They know that I'm trying to get them help. And then, or somebody actually shows up for an interview and they're just not going to be a good fit. And so they've got their hopes up for nothing. And it's,
and then so especially in that kind of, that situation, it's hard for practices to add nice to have things, like for example, like we'll be talking to a practice and say, hey, so how do you guys manage your wait list right now? They're like, how do we manage our wait list? You think we have time to call people on the wait list? And I was like, oh, sorry. Like they're like, no, like do we, some practices don't even have one. Other practices, if they do have one, if somebody cancels an appointment, like which of the staff members are you pitting the job on to start calling the waitlist people, right? I mean, like they're like, we don't have these extra people, but like that's really like what tech should be doing, right? Taking these tedious tasks and trying to automate them. Like one thing that I like to just like tell my practices is there's this like rule when it comes to tech, or not rule, but like saying, it's called if this, then that. So if you can think of a task that says, hey, when this happens, if this happens, then that needs to happen. That is when technology can come into place, right? So like, hey, listen, if we see a cancellation, then it needs to reach out for somebody on the wait list to ask them if they want to fill the spot, right? Like that, those kind of like thought patterns are where you could say, okay, because it's a tedious rule, right? Every time, if this happens, then I want this to happen. And your technology partners should be like kind of helping you or listening to you on those kind of situations and then taking them and making them a reality.
Yeah. And Sarah, I'm sure like while you were going through and like setting up this interview and reading resumes, that like during all that time that was taking place, nothing additional was put on your desk that needed to be finished, right?
Oh, like, God, no.
Oh, good. I'm glad. I wanted to make sure of that. So
we can all looking out, Greg. Good looking out.
We can all go back to, instead of doing our Sudokus and like crossword puzzles, to learning the new insurance rules that are out there. Because that's what I do in my free time.
I bet. Yeah. I just want to tell a really funny story here. Speaking of free time, Greg, I hope you remember this. So Anish and Greg and I and a bunch of other people we're we're out to dinner last spring in Washington, D.C. at the Askers meeting. And do you remember, Greg, Judge Duval?
Oh yeah, I still say it's a gold mine.
So
That's
Greg,
a separate podcast all
for
on
some
itself.
reason, Greg got it in his head that I'm judgy. And he told me so. He told me that he thinks I'm judgy. And we decided that going forward at some Askers meeting in the future, we should have like a charity event called Judge Duval. So this is just made me think of this because, in our free time and for the free time of those who are listening, if you want to reach out and help Greg and I make this charity event a reality,
that would be awesome.
Reach out.
I would love this.
Yeah, you were like, I'd watch the heck out of that.
Yeah.
So what was it? If you could come to Judge Duval with a problem, if it was, and I would basically judge who was in the right, the practice.
Yeah, it's a patient case. Like, was the patient right or the practice right? And like, it's just some crazy story because we all have them. This patient came in and this happened. Yeah. Who was in the right? And then Judge Duval gets to go through and make her bang the gavel, and then everybody gets to win. And I think it's a long running show because people listening right now probably at least just each themselves have 5 stories that come up regularly. Like, you remember when this patient came in and that happened? I think it's got legs. It's got its own podcast, to be honest.
Guys, this is a great, I love the charity aspect of this. Like, not only that, I think this could also be a great like little improv thing where like, okay, like you give someone a card and say, hey, this is what the patient's story. And then they go up against the practice administrator and let's just see who wins,
Ooh, yeah, it's got so much possibility, guys. So for those who are listening in your quote unquote free time, help us launch Judge Duval. I'm sure you can find a contact for me and Greg in the show notes. Reach out. So anyway, before we wrap it up, guys, why don't you tell us one more time a little bit about Promptly and how you can help those who are not current customers achieve some of their tech goals.
Well, Greg, you're the radio guy, so I'll let you put on an old timey voice and go through a quick
perfect. Summary. Yeah, it's 2 for Tuesday, even though it's really a Friday. I got it.
Yeah, there you go.
Well, I think you kind of alluded to what kind of makes us different too, is that we always try to be a proactive company instead of reactive, because obviously like things happen and the market kind of changes, and a lot of systems just have to now react. You have to go in and change processes because you were forced to. What we try to do is be very proactive. Like, where do we see the market going? And more importantly, what's the feedback from our practice partners? Like, our practice partners help us more than they know it. We do quick sprints with enhancements to our systems just from the feedback of our practices. Like, they have a great idea. It's most likely going to make sense for 95% of our groups that are using our system. And then we just roll with it from there. Like, we brainstorm it, we whiteboard it, we go back to the practices that had the idea and say like, hey, like, does this make sense? Like, where do buttons need to go? What's going to make this more efficient for your use? Because most likely it's going to be the similar workflow for all of our different practice partners, especially if we're looking at ophthalmology specifically. But, we really try to be that technology partner that's in it for the long run, to help in different aspects. Our system does a lot. You can go to promptlycheckin.com. It does a lot of different pieces. Doesn't mean you have to use all of them, but it's a great system to help with staffing shortages, to really cater to the preference of a patient. Like I said, not just pigeonholing. Like, if they prefer phone calls over text, email, if they like interacting with the practice instead of just like a system, like automating things, like there's different ways to transfer data, to transfer demographic insurance, and even just to communicate back and forth within the system itself. And we really try to be just that long-term practice partner that takes our feedback seriously and makes the system better. And obviously, like, support is the biggest piece. I really take pride in how our practices really, tell other groups or references about the support that our team brings, because as I'm sure everyone's aware, like, that's a killer for a practice if they're using something in place, whether it's the EMR, PM, or an outside solution vendor, that the support's just not there.
So tell us one more time, is it promptly.com where we can reach you?
It's promptlycheckin.com.
Promptlycheckin.com.
Yep. And then, I mean, honestly, overall, our goal is to really consolidate. I mean, for far too long, and even currently, practices are using, like I said, so many different systems. I think we're averaging, when we roll Promptly out, anywhere from 3 to 6 other softwares are all getting consolidated into one. And the whole idea is not only to bring that like airline automation experience to your practices, but beyond that, to consolidate down. Like, I mean, right now, I feel like a lot of ophthalmology practices, to steal an example, instead of having a Microsoft Office, like that's what I would relate Promptly to, kind of an all-in-one. They're currently using one software for word processing and a separate software for spreadsheets and a separate software for slideshows, where like a Microsoft Office would combine all of that, right? And that's what our goal is with Promptly, to make the patient experience better and to consolidate everything down into one simple, easy to use platform that just works with pretty much every practice management system on the market.
Awesome. Thank you so much to Dr. Anish Kapur and Greg Grasso for joining me today and talking on our podcast. We appreciate it so very much. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, kindly share it with your friends and on social media. Also, please don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.